Laser light therapy is one form of technology that many people with hair loss turn to for hair growth. But how successful is this therapy? And what advancements have been made in laser light therapy? I sat down with Dr. Robert Haber, a respected dermatologist and hair loss surgeon, to get the latest updates on the success of laser light therapy. My guest today is one of the most incredible international dermatologists and hair restoration surgeons in the world, internationally written up in written books, work training programs, and he has thousands of successful surgeries and patients that he has served here in Cleveland, Ohio. I want to welcome Dr. Robert Haber. Welcome. Dr. Haber, how are you?
I'm great. Thanks for inviting me. I look forward to having a conversation with you, Jeffrey.
You know, there's so much information in this information highway, Dr. Haber, as you know, but there's so much convoluted information. And lasers have obviously come out of the ground roots of your area of surgery and the things that you do dermatologically. And now they've really advanced into some support of hair growth and trichology. Can you give us some background and some of the where and how this laser light therapy has began and where it's at today?
Well, it actually started decades ago in the 1950s, which was an accidental discovery by a person doing some laser research on mice and found that lasers grew some hair. Nothing happened to it for a long period of time. And then a decade or so ago, lasers started to be used for hair, but most of us were fairly skeptical at the time. There really was very little science supporting it. It seemed hokey. And the original lasers were large, cumbersome office-based devices that were difficult for the patients to work with. They had to drive to an office. It was very expensive. And most of us who were very sensitive to misuse of patient dollars were skeptical of it. Well, what's happened since then is science, really. So as really smart people turn their mind to it, instead of just salespeople, we've learned a lot about lasers and how they work and why they work. And we've developed, and other companies have developed, a series of devices that people can use to actually grow hair now.
That's great. And you know, there's so many different devices out there right now. You've got the comb, you've got the cap, you've got the headband type, and then there's some new innovation from your point of reference of research that really give even full coverage of laser. What is the difference between a comb and, let's say, the other elements of lasers that we hear about? Because obviously laser works, but they're not all equal. So tell me the differences.
Sure. So the basic unit, the tiny little laser that everybody uses, that's the same. So whether it's a comb or a cap, it's the laser itself emitting a certain wavelength of light is the same. What makes one laser work better than another is really how well it's going to be used. No treatment, if it's cumbersome, if it's inconvenient, is going to be used. So the best laser is the one that the patient's actually going to be compliant with and use on a regular basis. As I was saying, the first ones they look like the salon hair dryers. You'd have to drive to a doctor's office 3 times a week. Well, obviously, that's very inconvenient, expensive, and the compliance was poor. The next device was the laser comb, an effective device, but a little underpowered. They only have a few lasers, and it was very tedious to move this along your scalp once every 4 seconds. So you could do it, and if you did it properly, it could work, but people just stopped using it. So in 2006, the Laser Cap company developed the first home use wearable device, this device right here, which is we call it a hard shell device. And this is the first cap that you could actually put on your head, plug it in, and wear it for 30 minutes while you were doing something else. You could wear it under a cap. So it significantly improved compliance. Again, the lasers are the same. We just made it a device that someone could use. Many companies copied that device, increasing the lasers, changing the shape a little bit, but all with the same basic hard shell. And what we've done in this year, 2016, we've come up with another innovative product, which is a soft shell device. That's this device right here. Much more comfortable, greater coverage, but still with the same laser. So it turns on and it wears this. But since it covers the entire scalp so beautifully and it's soft and it's comfortable, again, people are more likely to use it. It still can be used under a cap. It can be used, this is the first device that can be used without a cap and still have that comfort and convenience. So again, the laser is pretty much the same. Our focus is how can we get the patients to actually use the device in a comfortable way and deliver the amount of light necessary to grow hair.
Now, I know that you used some research in the development of that laser cap from the Harvard University. Research was done on the most optimum level of light therapy per a particular area. Can you tell me about that area of research and how your cap, the laser cap, implements that formula that creates the ability to get the best optimum level of treatment?
Well, Mike Hamblin is one of the world's leading researchers on photobiostimulation, photobiomodulation, which is what the official name of laser light therapy is. And he's come up with ranges of the amount of energy that needs to be delivered to the skin in order to have clinical efficacy. What hasn't been answered, quite frankly, is exactly what the best treatment is. So there's a wide range of treatment options that probably will work, and there's more science and more studies that are necessary to prove what the best thing is. In the absence of proof of what's best, we have to be able to provide the biggest range. So more is not necessarily better. Too little isn't going to work. Too much can cause harm. So this device has been using the available data to deliver the right amount of energy to each square centimeter of the scalp, again, to deliver an effective and safe range of laser energy to each area of the scalp.
And as you said, compliance really is the biggest problem if people are not either going to the location that was necessary in the beginning, or even if they've got a comb or they've got other systems, if they're not utilizing it. Your laser cap also gives the freedom of cords and the ability of having to hook up into a plug outlet. Am I correct?
That's correct. So it's a battery pack, so you can wear it on your belt. It's very easy. It's very, very comfortable and easy. The other thing is our battery pack is actually an intelligent battery pack, which is tracking usage. So we'll be able to know how much the patient's actually using it and give feedback, because we don't want the patient to, we stand by our product, which is very, very important, but we need to know, is the patient actually using the product? And so we'll be able to track some of that information and give feedback. If a person's only using it once a month and they say, hey, it's not working, well, of course it's not working. Compliance, we know in medicine, is much, much lower than what the patient tells us and what the physicians typically believe. When devices are created that actually track that, sometimes it's shocking how little a person is taking their medicine, taking their pills, using their cream. No wonder their acne is not getting better or their hair loss isn't improving.
That's right. Now, that laser, the laser cap, is not a retail item that is over the counter or at a drugstore or online. It's based through a prescription. Am I correct on that?
That's right. Well, this particular cap, and we will have a number of different caps available, but this is a physician-only cap. And that's an FDA rule. So the devices that you can sell directly to a patient that you can buy from an airline magazine, those are not the same power. They're much, much weaker lasers, and that's why they could be sold over the counter or through a salon or direct to consumer. The caps that are available through physicians only are the most powerful of the caps, and therefore they require a physician to be involved, to make sure that the disease process is correct, to make sure that the response is appropriate. If a patient is self-diagnosing and self-treating, they may not be doing the right thing for them. So we're focusing mainly on the physicians because, again, we're about the science. So if we have the science and we can explain that to a physician can understand what we are talking about and therefore make an appropriate recommendation to their patient.
It gives, if you hold that back up again, I'm a biker and I love the shape and design of it. It reminds me of my biking helmet. Can you just hold up that cap again? It's a beautiful design.
It's very nice design, and it's very comfortable. So it's very soft. It's very comfortable. You can wear this for a long period of time. And again, you could actually bike with this if you wanted to, although you probably couldn't put a bike helmet over this. But you can walk around with this. You can do a whole bunch of things. You can see, and it's a very comfortable, soft. It's a first of its kind. And what we believe is that this design is going to improve the compliance. Again, it's all about compliance. This cap, which is functional, it's hard. It's a hard cap. Every wearable device currently on the market is the hard shell, and it's just not comfortable. So you can wear it, but it doesn't feel good. This one you can't even feel when it's on. So it's the most comfortable of the devices. Again, it's about compliance. The lasers, the same lasers, but these lasers will be used by the patient because they're going to put it on and pretty much forget that they're wearing it.
You know, with the Nordstrom and the hair loss patterns, the male and female, that front edge is normally with a cap or even the comb are least likely to get treatment from the light therapy. Yours actually wraps, it looks like, right down into the sideburn area. I've not seen that in any of the designs that I've researched and worked with. So it gives another, I'm going to call it compliance reward. If they're using it, they're going to see an effect, which is going to be a positive, especially in the weakest and more dominant areas of loss. It really kind of excites me to hear that.
That's correct. There's a couple of unique aspects of this device. Is also this rim here comes off, and different size straps can be put on to customize it to. Not everybody has the same size head.
Mm-hmm.
So little heads and big heads, for the first time now, can have an appropriate size cap. We do cover the sides well, and this area in the back is particularly helpful because it extends back down far into the back of the scalp, which is outside the traditional realm of what we call pattern alopecia, or pattern hair loss. But for surgical purposes and for people that do have hair loss, this cap is able to cover that with more laser diodes than any other device in the market.
You know, as you well know, in female pattern hair loss, their diffusion or their miniaturization leaves them with hair, thin throughout their whole head. So they have, even by the back of the area of their occipital area, they have some miniaturization and thinning and scalp showing through. So that framework that you've created even allows that extension of where a female has a better ability to get the most optimal level of treatment, again, I believe, with regards to the design as well as the amount of energy that you're giving per square inch.
That's great. It's the greatest coverage of any device, and that's very, very important. Not everybody follows the rules. So we have the traditional, typical patterns, and if everyone followed the traditional pattern, we could have a simpler cap. But we all see a lot of people who don't follow the rules. Their hair loss is unusual. We have men with female pattern type hair loss. We have women with male type pattern hair loss. We have people that have hair loss extending throughout their entire scalp. So the ability to cover much more of the scalp allows a greater potential therapeutic benefit.
Let's take a look at the other part of this, which is the thing that you're the specialist in regards to surgery, transplant surgery. It's advanced itself incredibly over the last maybe 3 to 5 years, and even the last couple of years advancement. How much application is light therapy in pre and post been effective in your surgical treatments with your patients?
So hair transplantation, a successful hair transplantation is all about growth, right? We move thousands of hair follicles, and if they don't grow, we haven't done a good job. Now, most experienced hair surgeons experience and enjoy very consistent growth, but there are some hairs that don't survive the process. Remember, we've taken them out of the head. We've deprived them, at least for a period of several hours, of their normal blood supply, of their ability to clear toxins and things like that. So anything we can do to improve the survival of those very delicate, fragile grafts while they're out of the body will help. And we do that with holding solutions and temperature control. We do that with ATP. And light can help as well. So again, the laser experts like Mike Hamblin believe strongly that if we expose the hair follicles to light for a period, even just 15 minutes before we remove them, we boost their ability to survive while they're out of the body. And then immediately after surgery, if we expose the grafted follicles to light, we improve their ability to survive and enjoy healthy metabolism. So this is a very exciting area that not a lot of surgeons are using this pre and post operatively. And it's a subtle change because, if you're only getting 50% growth after your surgery, the laser cap is not going to rescue you. But if you're getting 90 to 95%, this can push you to 98%, 99%. And that's well worth it. So it takes someone who's already expert and make them that much better if we include this tiny bit to the recipe of the pre and post-operative program.
And as you will know, there's only so many hairs to go around. So if you're gonna not intensify your treatment for those hairs that you've transplanted and lose a percentage of them or their factor of really growing to their full potential, there's no more to go around after you've gone in there enough times to do the transplant. So this is almost a I think, a no-brainer for anybody who's going through, transplant surgery, to really make it a part of the protocol of treatment that they need to have to get the best, again, optimal level of growth, as you said, as well as giving the most optimal level of feeding to that hair before it comes out of the body and goes back into the body.
Well, that's right. People do ask me all the time, well, so you're going from 94% success to 98% success. Is that worth it? Well, it's worth it to the patients because they have a very finite number of hairs, and that translates into hundreds of hairs, which that's very, very valuable. So that small percentage of increase mathematically is worth everything to the patient who is spending, their hard-earned money on their hairs and on their surgery. It's the surgeon's responsibility to do everything in his or her power to make sure every last follicle grows.
Well, I'm really grateful for you sharing this kind of cutting-edge news with my listening audience of the Hair Loss Solutions TV program, because we're always trying to bring them solutions that are better and safe and not only reputable, but that work. And now, today, when I take a look at some of the doctor comparisons in plastic surgery, where they're doing surgery to the face and to the other parts of the body, a lot of the plastic surgeons are taking and utilizing estheticians to pre and post treatment of that skin and all of the areas of collagen to give the best optimum level of a facelift or any type of surgery. How do you look at right now Trichology in the same manner of being able to give that pre and post treatment for the most optimal level of your surgery, along with the laser cap?
Well, I think that's an excellent point, because if all we do is a facelift, I don't do facelifts, but all if you do is a facelift, you don't take care of the skin, then you haven't maximized the results. So care for the skin, whether it's, peels and microdermabrasion, is going to make that facelift look even better. And hair is totally analogous to it. If you have dry, frizzy, lifeless hair, but you transplant a lot of it, it's still not going to look very good. So having someone that understands hair, how to make it look its best, and how to quantify what's there. Is it a fine hair? Is it a thick, curly hair? What can we do to make each hair follicle stand out? That's, again, a very subtle and often overlooked process. And the physician has to be aware of that, but that absolutely is within the realm of care of a non-physician specialist who can just make sure they know what's going on with the hair, which is why we work very closely with hairstylists and salons, because they take care of my patient's hair much more often than I do. So I do my work, but they can help my work look that much better. It's very important for all hair specialists to work together to make the patient look the best.
It's a team effort, I really appreciate, Dr. Haber, you taking your time in between your surgery and all of the busyness of your lectures around the country. I want to challenge a thought for you right now in regards to a case study. I'd love to take an opportunity, since we're in the same town, and document video as well as document maybe a patient or two that we work together as a team with the Trichology and the light therapy and the surgery that would give a tracking of what we see and what you see as a surgeon, different, better, or otherwise. Would you be up for that kind of challenge, to be able to find the right person that we could say that they wanted to be a part of this case study and really put them through the Trichology, the light therapy, the surgery, and then the post follow-up of that same process? Do you think that you'd be open for that?
Oh, absolutely. I'd love to work with you on that, Jeffrey, and I appreciate the opportunity to have this dialogue, this discussion, because a lot of patients don't know who to turn to. They don't know what questions to ask. They can't differentiate, fluff from real. And I would love to work with you, and I'm sure we have any number of people that would be willing to work with us to that same goal. That's a great idea.
That'd be great. That'll be wonderful. I will have my assistant and everybody else contact your assistants and we'll get something going, because I think that would be a beautiful program to kind of, even to the professional surgeons that don't yet believe that the necessity of the light therapy and Trichology, now that is really rolling over over from overseas into the United States now, that really can help people not only get the best head of hair, but the optimum option out of the surgery that, is really limited to the hair that they have on their head. And you have to watch every one of those. So I will look forward to that opportunity to do those case studies with you.
Good, me too.
Okay. To my audience, listen to me. You have heard one of the best. For him to take his time, we are grateful at the Hair Loss Solutions TV program, and we will continue to bring you this kind of knowledge and inspiration to find a solution for you to look your very best and to find solutions that work, and that's what's most important. Dr. Haber, thank you so much for being a part of our program today, and I'll look forward to working with you in the future.
It's been my pleasure. Thank you very much, Jeffrey.
Thank you.
We want to thank our show sponsor, Wigs for Kids, whose mission is to help children look themselves and live their lives.
And if you'd like more information on this beautiful charity that helps thousands of children, log on to wigsforkids.org.
And remember, the answers to your hair loss concerns won't end here. The conversation continues with more experts and solutions to your questions on hairlosssolutions.tv.
And I'd love to hear from you. Send me your message or any concerns that you might have in the Ask Jeffrey section of our website. You can also subscribe to us on YouTube at Hair Loss Solutions TV.
Thank you for watching this episode of Hair Loss Solutions TV.
And remember, beauty begins within.